Texas Governor Greg Abbott has tested positive for COVID-19. The 63-year-old Republican is fully vaccinated. His office says he is currently in good health with no symptoms and is receiving monoclonal antibody treatment. Video from an event Governor Abbott attended Monday night shows a packed venue with little mask wearing. His office says everyone he has been in contact with today has been notified. Governor Abbott's diagnosis comes as he and Florida Governor Ron DeSantis are at odds with some school districts over mask mandates. Abbott had restricted local entities from putting mask mandates in place. Governor DeSantis also issued an executive order banning schools from requiring masks. He's threatening to pull funding from districts that defy his directive. The mask debate comes as the Delta variant ravages both states and young children enter the new school year unvaccinated. For more, I want to bring in Jim DeFede and Renuka Rayasam. Jim is an investigative reporter for our CBS Miami station, WFOR, and Renuka is a Texas correspondent covering politics, policy, and healthcare for Politico. Welcome. It's good to see you both. Jim, you recently spoke with the teachers union presidents in both Miami-Dade and Broward counties. Now, the Broward School Board has already decided to require masks inside the classroom despite the governor's wishes. Tell us more about where Miami-Dade stands on that issue.
So yesterday, Miami-Dade had a panel of medical experts that they had brought together almost a year ago to give them a final recommendation on the school year. Broward schools open tomorrow, Miami-Dade's follow a week later. So when the medical experts met yesterday, they recommended to the school superintendent that their masks be required, with the only opt-out being for medical reasons with a doctor's note. The superintendent says he'll support that. But tomorrow, the school board is expected to meet, and it is not clear if that school board will go along with that recommendation. The superintendent is getting some pushback, and we're hearing that there are folks in Tallahassee from the governor's office and from others who are lobbying the school board members to not institute a mask mandate.
Renuka, there has been a legal back and forth over a mask mandate for public schools in Bexar County, home to San Antonio. What's going on there, and what other legal challenges have we seen against Governor Abbott's executive order?
Sure. So the Texas Supreme Court has said that Governor Greg Abbott's order banning local school districts and local governments from instituting mask mandates can stand for now. But then we have courts across the state, like the one you mentioned in Bexar County and San Antonio, that said schools can go ahead with some of these mask mandates and local officials can do this. And so at the moment, you have this just incredibly confusing patchwork of local regulations. You see a lot of cities and school districts in the state defying Greg Abbott's order and instituting mask mandates. I'm here in El Paso County, where school has already started, and the school district just said that they were going to make students and teachers wear masks to school.
Well, Jim and Renuka, I want to take a closer look at the decision-making on masks. Why do governors in both Texas and Florida feel confident in their directives? Jim, I want to start with you because, I wonder both from a scientific data perspective, from a political perspective, what are those factors that appear to have influenced the decisions that were made on that in your state, Jim?
So the governor here, Governor DeSantis, has basically put together his own panel of experts, his own cherry-picked group, who are not in the mainstream of scientific thought throughout this pandemic. And so he's picking who he wants to listen to and has been railing against Dr. Fauci. In fact, his re-election campaign is selling beer koozies and other items that sort of talk about don't Fauci my Florida, and essentially also saying, you can't drink a beer through a mask. This is the level of products that are being sold on the governor's website. So part of it is, though, that DeSantis, I think, is the victim of his own success. Early on, he took a different tact in the pandemic than Governor Cuomo did by shutting down the nursing homes and locking them down. That proved to be the right strategy. But now he's doubling down on a new strategy, which seems catered towards more of a political point of view than a health point of view. And it plays very well among conservatives, let parents decide, as opposed to following the science, which says that masks do in fact work.
And Renuka, what about in Texas? What's behind the decisions being made there with Governor Abbott? And, how do you think this recent turn of events may or may not affect his own way of viewing this, being diagnosed now with COVID-19?
Right. I mean, so here in Texas, things are slightly different than what you described in Florida, Jim. And so Greg Abbott is talking to experts. I spoke to some of those experts, Mark McClellan, and people who know what they're talking about when it comes to the science of COVID. But Abbott is being pushed into a corner when it comes to his reelection campaign next year. I think he's in a dominant position now, but he's facing 3 Republican primary challengers, and they are all hammering him over this issue of mask mandates and COVID restrictions. And so this is, Abbott's way of boxing out some of those competitors, those Republican primary challengers on the right, to say that, as you mentioned, this is a popular conservative message to say that you're against masks and that you should let parents decide. And we've heard Greg Abbott say that a lot, that it should be about personal responsibility and individual decision making as opposed to a mandate from a school district or a local official. And that's definitely playing well to his conservative primary base at the moment. I think the recent diagnosis definitely throws a wrench in that. I think, my sense of what I've seen, even from a year ago when we saw former President Trump get COVID, Abbott has been vaccinated. He's been tested daily. He's being treated right now. I think this will likely be a case for him to say, hey, I haven't shut things down in my own office and I'm going to be okay.
Jim, in our final minute, Governor DeSantis held a news conference Monday on monoclonal antibodies. That's the same treatment Texas Governor Abbott's office says he's currently receiving following his COVID diagnosis. But tell us more about Governor DeSantis's focus on this treatment.
This is truly interesting because what you're seeing is he's now taking the view that essentially people are going to get COVID. And the question becomes, what do we do when they get it? That the vaccines are not as effective. That's the messaging he's giving, as we were led to believe. And so therefore, these monoclonal antibody treatments are what he's now banking on. The problem is going to be this. Look, we are just now opening up schools. In Hillsborough County, more than 8,000 students are currently in quarantine because they had a contact with someone in COVID. More than 300 teachers and staff are also facing that. As Broward opens up tomorrow, as Dade County opens up next week, as other school districts open up, if you begin to see more and more students coming down and having contact with people who have COVID, and that affects the ability for schools to remain open, that's where this is really going to come to a loggerhead, I believe. And no matter how much he wants to talk about monoclonal treatments, he's not talking about vaccinations anymore. He's talking about treatments after the fact. I think that's going to be the problem that Governor DeSantis is going to have to deal with, where this strategy may backfire on.
All right, Jim, DeFede, and Renuka Rayasam, it's good to have you both. Thank you very much.
Thank you.